Well, if it's an adolescent, the dosage of mercury alone every year is really, really additive and can cause brain injury in some people. People with ME, if you're over 65, you don't seroconvert to flu anyway. They give it to all the people in the old people's homes to stop spreading it, but it doesn't help the patient if they're over 65 because you don't seroconvert. Almost any immunization over the age of 65, you don't seroconvert, meaning you don't build up antibodies adequately. Few people might, but not sufficiently. So I'm not one for flu immunization. I've seen too many bad things. They're not the same thing. Chronic fatigue syndrome was invented by Stephen Strauss, who thought he had chronic fatigue syndrome when he had a brain tumor. You have to examine these people. I think, and the only way you can diagnose ME is you do a brain SPECT when they're tired. It's as simple as that. And if their brain looks perfect, something else is causing their fatigue. It's not a brain injury. ME is only diffuse brain injury. Chronic fatigue syndrome can be any of that list of things I showed you in the slide just before. That's chronic fatigue syndrome. Anything. Plus another 100 things that are on this list. Those are the ones that we find most frequently. So it's silly to really, and first thing, when I'm doing a report for disability insurance, everyone's got free medication with Medicare in Canada, but when I'm doing a report, I never mention the word ME. I never mention the word fibromyalgia. I never mention the word chronic fatigue syndrome because the lawyers who are working for the insurance companies have all these experts who come and say, oh, everyone knows that chronic fatigue syndrome is a minor psychiatric disease and the people really can work. So you never mention that. You go to the heart of the matter and you go and you say, what is really wrong with these people? Well, I've mentioned the problem with Dr. Chia, and we don't know if that's going to help. He's had good success. We're just starting on those treatments. That's skeptical at the moment. I just don't know. All I know is there is no good anti-enteroviral medication in existence at the moment. A lot of things I don't know how to treat. One thing I have noticed in ME is people with money get better faster. And it's not because they have access to physicians. What it is they've got a cushion. And I've had a lot of doctors, and I mentioned this earlier to someone, I've had a lot of doctors come down with severe ME and diffuse brain injury after that epidemic period. And those with insurance stopped working for a year or two, were able to relax, had money coming in, were able to live a healthy life, weren't under any stress, their mortgages weren't being taken out from underneath them, their spouses didn't run away on them, everybody was happy, the kids were happy, and they got better. Not everyone, but most of them, to some degree. None of them came 100% better. The doctors who were saying, God, I'm only 35, what do I need health insurance for? Disability insurance, and didn't get insurance, or they just graduated and they came down with that epidemic. Not one of them, not one of those doctors is working today. Several of them committed suicide. They didn't get better. So the ability after you fall ill to do nothing except relax, live a healthy life, gives the body a chance to fix itself. There's no better physician than the body. Truthfully, what are you treating? You have to go back to my basic concept. You have to investigate the patients thoroughly to find out why they're ill. A lot of these things you can treat, and you guys will be back to work, back to school, back to anything. postural orthostatic tachycardia syndrome, which is one of the classic dysautonomias. We see it most commonly after recombinant hepatitis B immunization. We got 200 patients I mentioned earlier with POTS. And what POTS is, for those of you who don't know, if you move, your heart goes, which should be running between 60 and 80 beats per minute. It should drop down until about 45 when you're sleeping. What happens with the POTS people, when they're sleeping, it might drop down to 55, 60. When they're trying to move and do anything, and during the day, their heart rate is over 100, which is tachycardia, or close to it, in the 90s. If they get excited, or if they do try to do anything, their heart rate may instantly go up to 150, 200. You put them on a treadmill, they'll go up to 300, and you have to stop them. So POTS is a major consequence to several things. Number one, a brain injury, an injury to the system regulating the pressure in the blood vessels, and we mentioned that earlier. I just didn't use the word POTS. This lady or man has acute onset of ME in 1990 after pneumonia, had years of recurring infections, so otherwise there's the immune breakdown here. Now in 2012, I've got Sjogren's syndrome. It's amazing that you didn't have it earlier. Positive salivary joint enlargement. He wants me to be, do I have autoimmune disease? Of course you do. Replacing ME or both. Forget about the names ME. Forget about the names chronic fatigue syndrome. Forget about the names fibromyalgia. Ask what is causing this real symptom. Because that's, and the only way you can do that is you can't run off and get a test. You have to have a total body examination. I've tried to send to your group my working profile. I'll send that to you, and you might even want to publish it. This is my routine investigation, and this isn't the total investigation. But it would give you an idea how extensive my examination is. And I'm not looking for patients, by the way. We do see patients, but I try to avoid them. They take too much time. No, that's all I do, actually. But we do Skype interviews for 2 hours with patients, and sometimes we can help them, but sometimes not. We do tuberculin tests on every patient. We've picked up 5 cases of tuberculosis among people who think they've got chronic fatigue syndrome. And it's so simple. All you need is a little skin test, costs nothing, you get the stuff free from the American or the Canadian government, wherever you are. Put a little bleb underneath the skin, and if the next day you've got a big red reaction, you may have tuberculosis. You could have other diseases which blow up. But it's a simple, simple test. How many have had a tuberculin test? Stick up your hand. Well, thank God for your doctors. That's excellent. Unfortunately, in Canada, they're not as good as that. It really doesn't work, this treatment. I don't know a treatment that works. The idea of chelation has made a lot of people rich in Canada and the United States when they do this. But what happens with heavy metal toxins is it goes in the brain. And we had some serious injury to farmers when I was working in Glasgow for a short while. And the doctor was doing every test they could on these farmers. And yeah, we found exposure to different kinds of pesticides, herbicides, and metals, but nothing special. And they put them through chelation, they put them through all sorts of things, and eventually, but there was nothing that we could really prove until they died. When they died, we got their brains. Their brains were so solid with mercury, so solid with pesticides and herbicides, And I phoned the Mounties, our national police force, I guess a little bit like your FBI and CIA combined. And I said, what if you want to murder your husband with a nice milkshake of herbicides and pesticides? How are you going to tell? We can't. We can't. So the testing alone of these things is not easily done. Now they do hair samples, they do all sorts of tests in the States, but how useful they are is another matter. It doesn't contribute. Those are the worst. The POTS and the autonomic nervous dysfunction, those people are so terribly ill. Those are the ones that are not here usually. The better POTS and the better dysautonomias might be here, but the serious, serious ones are home in bed right now. And they don't even know that there's a Massachusetts organization to help you. They're that ill. These are dangerously, dangerously ill people. They're a combination, as I mentioned earlier, of Ehlers-Danlos type syndromes or Marfan's, plus genetic problems, possibility, plus other injuries, whether they're chemicals or other things. There's a lot that's not known about this. I'm attending a meeting, so I hope this blooming hurricane gets finished soon. On the 31st, I'm attending a meeting in the Bahamas for 4 days on dysautonomia. So if you had me after, I'd tell you a bit more. What can you tell us about the relationship to gender? I'm all for it. My wife back there. Relationship to gender. I mentioned earlier about the difference between rheumatoid arthritis and girls and boys. The boys don't get it and the girls do. What you're looking at with women is they have a very different immune system. 80% of all of the ME CFS type patients are women. 80% of all of the multiple sclerosis are women. 80% of the rheumatoid arthritis are women. They have an immune system which is organized so that when they get pregnant, they don't reject the baby as an autoimmune system. Their immune system shuts off as part of their natural productive society to develop and build a healthy child. And so they already have an immune system which shuts off and starts on its own. And so they're much more vulnerable, women are, to any autoimmune disease. And most of the chronic fatigue syndrome groups of diseases we've talked about are highly related to the autoimmune system. The question is, are women who've had children more likely? I don't know. I've never done the statistics on that. Last time we did statistics was around 15 years ago when we were looking at thousands of patients after the epidemic period of 84 to 90. It finally petered out. And that's one question we didn't ask, and that would have been a really useful question. I'm sorry, I don't know the answer to that. ME is a diffuse brain injury that is measurable. If you can't measure it, you don't have ME. Chronic fatigue syndrome depends if it's acute onset or gradual onset. If it's acute onset, it's probably a combination of genetics, immunization, medication, viral infections, things you can't always prove. Trauma, brain injuries, it's a combination of things. Gradual onset is one of the most interesting subtypes of chronic fatigue syndrome because it almost always is something which is building in you. Those are the ones we find cancers in. Those are the ones that we find organ injury in. And those are the ones that are often best treatable, the gradual onset. But you have to find out why. That's not important in the sense that most people who have acute onset ME get better. If they're not better within a year, they relapse into what we would call chronic. And very few of those people get better. But even in that group, probably 20%, 25% do on their own. But that still leaves a huge amount who don't get better. But again, you have to stop thinking in terms of chronic fatigue syndrome, and you have to stop thinking in terms of fibromyalgia ME. You have to say, what is causing my chronic fatigue syndrome? That is absolutely essential, because it's at that level, if you can answer that question, you have a chance of curing the patient. And that's what's most important. I'm old, I'm 76, and I don't feel old. I feel like I did when I was 20. And I've had all sorts of things go wrong with me. But I've had some really good things go right with me, which one of them sitting in this room. I fell ill, I guess, in grade 8, so I must have been around 11, 12. That was 48, and the vaccines came out in 54, 55. But even those vaccines that came out in 54, they tried them in the island of Newfoundland. There's someone here from Newfoundland. They tried them in Newfoundland, and they tried them in the island of Grenada in the Caribbean. They killed pretty well everyone they gave the immunization to. And so they withdrew it, of course, and they worked on it a bit more, and then they reintroduced it somewhere else, and it didn't kill the people. And ever since, it's been the safest immunization known to God and man. It's a wonderful, wonderful, wonderful invention. The risk of your child dying, and you hear about all the paralysis, you don't hear about all the deaths. Most of these kids died. And it was a horrible time, not just the kids, the parents. And that's another thing. It was mainly women who died, not kids. And you never hear those statistics. Never hear it. Because you couldn't get money for women, but you can get money for research for kids. And I don't know if you're old enough to remember, it was little Jimmy who was the advertiser, because even mothers would give money for boys, but they wouldn't give money for girl children. So in the years of the 1940s, it was little Jimmy, March of Dimes, and the women were never mentioned. And only later they brought in the girl. Well, I was on the medical committee in Canada of the Ledain Commission, which looked at the safety of drugs. And the Ledain Commission came out showing that everybody, that marijuana was not dangerous at all. Now, what nobody knew about the Ledain Commission, everyone was a pothead on it. And so the entire study, which, other than Judge Ledain, he wasn't on pot, is a neighbor of mine. At least to my knowledge, he wasn't. But the point is that you can't believe even, I think it was a $5 million study. It was contaminated by the people. Everybody on it was on pot. Medical cannabis can cause, it depends if you're taking it by a pill or if you're taking it by a cigarette or taking it internally as the wild stuff. All of my friends who grow cannabis in Canada are as ill as can be. They're all really ill people. I mean, not psychiatrically, they're physically ill. And they smoke it all the time. There's no advertisement for it as a product. Does it help you sleep? Yeah, it does. So does cocaine. So does morphine. But do you get good sleep? And the other thing is anything which you inhale into your lungs is causing you major, major damage. So I'm not one for cannabis. And I've got several patients who take it. One of them was in on Monday. Wonderful guy. He worked as a mule. He carried drugs in from Europe, and he got caught the first time, and they put him in jail, and he was in jail for 2 years. He loved it. Free food. And none of the other prisoners could escape him, and he kept on talking like I do all the time. And so he loved it. But you got to see this guy's brain. It looks like confetti. I mean, it looks like lace. I've never seen a brain so full of holes in all my life. It looks like a sponge. And he's got cancer now of the lung, and we got that out. I'm not a fan of... I'm a bit of a Puritan. I hardly drink. I've never smoked, except when I was a kid in England, I stole a package of Camels out of the back pocket of American soldier when I was 4. And we went down into a bunker and smoked them, and I tried the first one. And I thought, that's enough for me, and that was the last time I smoked. We almost always win. And it's not because we're good, it's just what we do. And I'm talking about insurance companies for disability programs. I'm a crook. I make average of $40,000 a year in medicine, and every now and then I buy a property and sell it at a ridiculous price 5 or 10 years after and make a couple $1 million, and I live off of that. It's really easy to make money. It's just boring. But in medicine, I just like trying to figure out what is wrong with people, and that is a lot of fun. And we charge a lot of money. I think we charge $10,000 to see an American patient, but then we do the tests in Canada as well on them, which takes up about $6,000 or $7,000. And and the Canadian patients we charge, I think it is $3,000 or $4,000. It takes us 18 months to investigate them. And we do a better job than any of the big American clinics that are charging 20. And I'm not advertising because we don't need to see patients. Insurance companies are really easy to beat if you know what's wrong with the patient. And most of these patients are seriously ill. We have never, out of the last, we've done about 2,000 patients only since 1984, and most of those are in the last few years, and or most of them were in the early years. Now we take much longer to investigate them, and we hardly do more than 20 new patients a year. And what we find with those people is that, with one exception, we've won every insurance case, but they're easy to win because they're so ill, and you get all of the tests back and show that this person is really, it's amazing they're alive, some of them. They never go to court. They never go to court. I mean, they settle before. I must say, I really enjoyed talking to you.